Hi, my name is Sandra McGarrah. The class is IDET 5310, and this is my presentation for this class. The title of my presentation is One Pill Can Kill? A Look into Fentanyl. So I've divided my presentation or module into 4 different parts. Part 1 includes the history, definition, opioids, and names of opioids. I give a brief description about fentanyl, that it was developed in 1959. It was introduced to the United States in the 60s, but it was an intravenous anesthetic, meaning that it was not illegally used. It was only used by doctors and in hospitals. Fentanyl has 2 ways to spell it. You'll see that it's with a Y and also with an I. It's a very powerful opioid, and it's used for pain medication or anesthesia. I found information that showed that fentanyl is 50 times stronger than heroin, and it's 100 times more strong than morphine. These type of opioids, because fentanyl is an opioid, they're used to block pain signals between the brain and the body. And they're usually treated for moderate to severe pain. In addition to controlling pain, opioids can make you feel happy or high, and they can definitely be addictive. Then I go on into opioids, about different kinds of opioids, and one of the most popular kinds that we know on the market have been Oxycontin and Vicodin. Of course, opioids don't come without risk. You can get addicted to them, and it's very hard to get off of it. I put down some names of legal opioids that are prescribed by a doctor. So there's a whole list here. You may be familiar with some of them, and you may have never seen them before. I added a quiz for this part 1, and I've asked the student to go in and choose match. This is in Quizlet, so they get a little bit of variation each time they do a quiz in this lesson. Second part is what is fentanyl, part 2, and this is going to cover where is it manufactured, how can you safely use fentanyl, and what makes it dangerous. So they have traced back that China and Mexico are the 2 countries that traffic it, and they're lacing it with various drugs and bringing it over the border from Mexico to sell to people in the United States illegally. Safely, a doctor can give you fentanyl through a shot, by a patch, lozenges, or a pill. Fentanyl is very dangerous. It can be deadly. The potency of fentanyl is very, very strong. If you take too much, you could overdose. Many drug dealers, of course, obviously, that sell laced drugs with fentanyl won't tell their buyers because they're trying to get away with a bigger profit. And it's a less expensive substance. Fentanyl is much cheaper to make than any of the other drugs. There's another quiz, and this time I asked the students to do flashcards to go through the various questions. Part 3 is called What is Fentanyl? This goes over how is it sold, what is a lethal dose of fentanyl, some examples of illegal fentanyl, and some street names. So fentanyl, illegally, it is sold as a nasal spray. It may be sold as a powder, or it may look like pills that look like prescription opioids, but it really isn't. It's actually fentanyl-laced medicine. If you look at this example, I found this fascinating. A little bitty speck of fentanyl is lethal. So if you look at the little speck compared to the penny, that's how much could kill you. And they mix fentanyl with other drugs. They lace ecstasy. They may lace heroin, Xanax, oxycodone. So if you notice, these are some examples of what it might look like. There's some street names that are used for laced drugs that are laced with fentanyl. And here's some examples. Some of them are kind of funny, but it's not a funny matter. But these are names, if you hear them, then they're talking about fentanyl. China Girl, Chinatown, China White, Dance Fever, Goodfellas, Poison, Tango, and Cash. Those are just a few listed here. Then you get to part 3. In part 3, I asked the student to choose Learn in Quizlet, and that'll be on the left to begin that quiz. Lastly, my last part is What is Fentanyl, part 4, and it's about overdosing and addiction. So if you look at the top left, it's showing you, compared to a dime, how much heroin is lethal, how much fentanyl is lethal. And this is a new one that's called carfentanil, and that much is lethal. It's just a tiny little speck. And I am assuming that this is going to be something that we will be seeing in the future, that fentanyl will be less, and this new drug will be what will be coming to the United States. The drug that they use to reverse a fentanyl overdose is called naloxone. Multiple naloxone doses might be necessary because of the fentanyl's potency. So if you feel someone is overdosed with fentanyl, you need to get them to emergency room to get critical care as quickly as possible so that they can have this drug however many times they need it to bring them out of the fentanyl overdose. They have found with research that there's certain medications with behavioral therapies. They're effective in treating people with the addiction to fentanyl and other opioids. So there is ways to be able to get off of it. The problem is if you take too much at one time, it's going to kill you. The very last item in my presentation is part 4 quiz. And here I've asked the student to go back to Match in Quizlet or do flashcards in Quizlet to review the part 4 of addiction and overdosing. I feel like I've covered quite a bit in this. I'm going to spend the next week and go and do some revisions, and I want to maybe add some more to overdosing and addiction to this very last section. And I feel like my presentation will be ready to be finalized by next week. If you watched my presentation, thank you in advance, and I hope you enjoyed it. I hope you got something out of it. Thank you.